the Central Clinic of Chiropractic. And if you're dealing with pains in the body and you're looking to avoid surgery, they can help you out. We got to sit down with the two doctors to hear a little bit more about what they do here. So let's take a look at what they have to say.
My name is Dr. Jordan Reiser, originally from New Jersey. This is my wife, Shannon. We met in 6th grade and we moved to South Carolina, and we went to school at Sherman College. We were there for 4 years. Decided to open our own chiropractic clinic. We moved to Sumter, South Carolina. We looked all around, looked at Beaufort, Bluffton, Charleston, and we just felt at home at Sumter. And we opened this clinic in July 10th of 2020. So we're going on 5 years on the 10th, July 10th. So the main focus with chiropractic is we want to help the body work at its best. So sometimes the spine can become misaligned or damaged, and when that happens, it can create pressure within the nerves that come out. And when that happens, it's almost like there's a kink in the garden hose. So if the water trying to get through the hose is interrupted, it's not going to come out the way that's supposed to. That's the same thing that happens with the nerve. So if that nerve is going towards your stomach, your heart, your lungs, we're going to see an issue with how that nerve starts to work and anything that it controls. So our goal is to analyze the spine for these misalignments, adjust them as specifically and safely as possible to restore more function to that area and help get the pressure off that nerve. A lot of people, if they have pressure on the nerve, it can lead to sciatica, numbness, tingling, back pain. And the common route to go is with a pill, potion, or lotion. So it's a pain medication, an injection, something to kind of treat the symptom, but not really treat the cause, right? So our goal is to work on the structure to help get that back to where it needs to be so it can help function properly.
Why else chiropractic people search out chiropractic is mainly for pain, because we have such a big pain management issue in this country right now that only prescribes opioids and medications. But when they come in for their pain, low back pain or neck pain, they find out that migraines start to get less, headaches are less severe, sinus issues start to go away, allergies are less severe every year, digestive issues get better. So you just find that your body does, like he said, functions on a better level when everything is fully aligned and connected and balanced. So in our clinic, we are a corrective clinic. We don't do much pain management. We don't treat pain like a Band-Aid. And when patients come in our office as new patients, we go through a very thorough consultation with them, all about their health history, previous accidents, previous injuries. Then we go through a thorough chiropractic exam, and what that looks like, we do some range of motion, we static palpate, we motion palpate, we do a surface EMG scan, a software called the MyoScan, and that's able to show us how balanced their system is and how well everything is working together. It also shows us imbalances in muscle tightness, weak muscles, things like that that could be chronic issues. And after we do our exam, then we go through full spine x-rays from top to bottom in a couple different angles, and that's regardless of where your pain is. Because we look at the body as a whole instead of individual parts, we want to see that if the pain is coming from a different cause, we need to correct that cause instead of just managing their pain. And then after we go through that visit, the doctors take their time to go over the x-rays, go over the exam, and then we go through what treatment options we have available for that patient. So every patient that comes into us is customized, individualized for what they're experiencing. And we can go through different therapies to help out with other conditions. We can go through physiotherapy, exercises, stretches, strengthening portions, and along with adjustments to just completely take a look at every area of what they're experiencing.
So we're a corrective care clinic, so we're not just your standard walk-in pain clinic. We believe that using chiropractic only for pain is like only taking vitamins when you're sick. There's a lot more to it. It's for the overall function of the body, not just for the 10% of the nerve that's the sensory, right? We focus on the other 90%, which is autonomic and motor. So how we move, how our body functions. The sensory is important, but we're more concerned with the other 90% of that nerve. Besides chiropractic adjustment, we focus on decompression.
Obviously, if your hips are off, you get adjusted, your knee can get better, but if there's a certain knee condition that can't get fixed with solely just adjustments, then that's kind of where this comes in.
So we have cervical decompression, we have lumbar decompression, and we have our knee decompression. So what that therapy is good for is people with like degenerative disc disease, if they have a bulging disc, if they have sciatica, numbness, tingling, things like that, or if you have like a bone-on-bone knee. Because what it does, that therapy helps decompress that space to allow nutrients and everything to heal that disc or the ligament in between, because ligaments themselves don't have a direct blood supply, so that creates almost like a negative pressure to allow those nutrients to get in, and we've seen some really good results with it. We actually had a patient, he was going to go under surgery for it was an L5-S1 fusion surgery. We got him in, got x-rays, went through his exam and everything, and he actually got on a decompression program. And at the end of the 3 months of the decompression program that he did, he actually ended up canceling the surgery, which was awesome.
He didn't need the surgery anymore.
Yeah.
We're the first and only ones in Sumter to get a knee decompression, and that knee decompression is able to help patients that have arthritis in the knee, previous meniscus issues. Even people that have had fully replaced knees are able to get this after a certain amount of time from that surgery. So a lot of conditions that really are managed right now medically with medications, pain management, shots, things like that, all of that stuff can be helpful for a time, but if it's not a long-term goal for that patient to do that for the rest of the time they have that condition, then this is a great alternative and the best start before you go that medical route.
And we've had a patient, we had him do a squat before that, and when he did it, he could not do even like half of a squat, right? So then we got him on that therapy. It was about 5 minutes later. It helps kind of, like I said, decompress the knee. After that, he got up and we had him do it again. It was a perfect parallel squat. So it's really, really cool.
We are a primary care office. We do not need referrals. If you get a referral from a medical doctor just recommending that you come to us, absolutely we accept that. Otherwise, it's really just up to the patient to give us a call if they're struggling with anything that we can help out with, and they can schedule their appointment from that point on.
So if you're struggling with things like migraines, neck pain, stomach issues, arthritis, anything like that, and you want to help avoid surgery, please give us a call and we'd be happy to help.
And we're located right here in Sumter, right down Main Street, on Calhoun Street, 11 East Calhoun Street, and our phone number is 803-757-1700.